One vial of a healthy man's ejaculate contains about 40 million sperm. In severe forms of infertility, there may not be a single one. The andrologist at the IV Med clinic will tell you how sperm quality is checked, and most importantly, what to do if the test results are disappointing. It all starts with this room. Here, VittoriaVita's clients provide semen. But in order to get the right sample, you have to follow a few rules.
The first rule is abstinence from sexual activity for 2 to 6 days. Otherwise, the concentration and volume of sperm may differ from the usual ones, and we will get an unreliable result. The second rule is not to drink alcohol or smoke for at least 2 weeks. Third, do not overheat or supercool yourself. Saunas and baths should be excluded at least 2 weeks before sperm donation. The thing is that the temperature of the scrotum is 1 to 2 degrees lower than body temperature. When overheated, sperm concentration and motility change and decrease. Another important factor is medication. After taking the medication, at least a week should pass. During this time, the body, including sperm, will recover and renew a little.
On the day of sperm collection, the client receives an individual jar with an electronic chip.
Patient scans this chip and sees his photo, initials, and other data on the screen. Thanks to this system, it is impossible to mix up materials. After providing sperm, a man puts a jar in his metal compartment and presses the bell. Thus, he informs us that everything is done. The container goes straight from here to the andrology laboratory.
On the other side of the wall, the andrologist receives a jar of sperm. Tests begin after 30 to 60 minutes. During this time, sperm becomes less viscous.
The main analysis that all patients undergo is a spermogram. Based on its results, other examinations are prescribed. Clients who are preparing for a surrogacy program usually undergo DNA fragmentation, oxidative stress analysis, and FISH analysis.
Before starting the analysis, the doctor identifies the client again. He signs each dropper. The first step is to determine the amount of material.
Here we have a volume of 3 milliliters. This is a good indicator.
Spermogram is a basic analysis. It shows the concentration of sperm, their motility, pH level, and morphology.
Glass under a microscope is divided into cells. With their help, we determine the concentration of sperm, first in 1 milliliter, then by the formula in the entire ejaculate. Look, here we can see live motile sperm, but there are also dead ones. We only count the living ones and pay attention to their structure and mobility. If there are no spermatozoa in the sample, then we send the entire ejaculate for centrifugation. Container with the sperm rotates inside the apparatus at high speed, and as a result, healthy spermatozoa settle to the bottom and damaged ones float. Usually, after a centrifuge, we find at least a few sperm.
But a good spermogram does not guarantee that the sperm is of good quality and fertilization will be successful.
There are genetic factors of infertility. A sperm DNA strand may be damaged, and chromosomes may have abnormalities. To identify such abnormalities, we conduct a DNA fragmentation test and a FISH analysis. DNA fragmentation is the breaking of DNA strands into pieces. This can occur during sperm maturation or under the influence of external factors. Age-related changes, radiation, varicocele, all this affects the structure of DNA.
The DNA fragmentation test consists of many steps. First, the embryologist mixes sperm with agarose.
Agarose is a special viscous substance that helps fix sperm. If agarose is not used, sperm will spread and slide off the glass.
First, sperm is applied to a laboratory glass and refrigerated for 5 minutes. Then, they are kept in 4 types of solutions and washed with 2 types of alcohol. Only after that, the embryologist adds a coloring matter.
some spots are sperm without DNA fragmentation, but this one, which is clearly defined, is fragmented. That is, its DNA chain is broken. In healthy sperm, a maximum of 30% of sperm are fragmented. The trick is that our colors paint chromatin, the substance that chromosomes consist of. If the sperm cell has a broken DNA strand, then in this method, SCD method, the chromatin of the damaged sperm is distributed much closer to the nucleus, while in the normal, in a larger radius. Fragmented spermatozoa are not able to fertilize an egg, but if fertilization does occur, then fragmentation can cause genetic abnormalities in the embryo.
Another way to look inside the structure of the sperm is to conduct a fish analysis.
The fish analysis shows whether everything is okay with the chromosomes set in sperm. Are all chromosomes in place? Do they have any mutations? Are there any extra chromosomes? We analyze 13, 18, 21, X and Y chromosomes. It is in them deviations provoking Edwards-Down-Patau syndrome are most often found. Next time, cytogenetics will tell more about the fish analysis.
Another analysis that all VittoriaVita clients undergo is an oxidative stress test.
This tiny chip and this device help us check the level of oxidative stress. We put some sperm here and wait. The results are displayed on the screen. In the course of their life, cells form active oxygen species. If there is too much oxygen, it destroys the structure of spermatozoon, its membrane, and even DNA.
If the sperm is of good quality, the andrologist writes the corresponding conclusion. A few days later, the man donates sperm again, and doctors use it for fertilization. But what if the tests are disappointing?
Healthy spermatozoa can usually be found even if the test results are very disappointing. In this case, our task is to separate healthy cells from damaged ones. For this, we use a sperm chip. We put sperm here and it goes through a lot of microtubules. Healthy spermatozoa overcome obstacles and damaged ones remain. This procedure is a gentle alternative to centrifugation. If the client has high oxidative stress and sperm DNA fragmentation, he is better off using chipping. In a centrifuge, individual sperm can be damaged. This does not happen often, but sometimes it happens. And when there is little healthy sperm, you cannot take risks. In critical situations, IV med doctors recommend MicroTese. This is a sperm collection directly from the testicular tubules, using a thin needle. There they are the least fragmented, and they can be used for fertilization. This is a simple and quick operation. In a few hours, a man can go home.
Male infertility is rarely absolute. Usually, even in the most difficult situations, you can find several healthy sperm that will give life to your future baby. We believe that you will soon become parents.